All right. Good afternoon and welcome to the Health and Government Operations Committee. This is voting list number 22. It is Thursday, April 3rd. It is 2:04 in the afternoon. I want to thank the committee for being here, on time so we can start. And those of you that were not on time owe me a piece of key lime pie. Some of these bills, for those of you that are watching at home, we already have seen it. They have passed this House, the companion bill, and we have had hearings, had it in subcommittee. So if we go fast, we know them already. Let's start with House Bill 1515. It is Delegate Collison, Certificate of Need, Intermediate Health Care Facilities Exemption. It is Aaron and Collison. Aaron.
This bill specifies that an intermediate care facility that offers medically managed residential substance use disorder treatment services may establish, operate, or change the bed capacity if written notice of the intent to establish or operate the facility or change bed capacity is filed with the Maryland Healthcare Commission at least 45 days in advance, and the Healthcare Commission finds that the proposed facility or change in bed capacity is not inconsistent with the state health plan, will result in the delivery of more efficient and effective healthcare services, and is in the public interest.
Vice Chair Collison.
Thank you, Madam Chair. This is a bill that was brought to us by MHCC late after the bill deadline, which is why it's so late, and I apologize for that. It is a simple bill that they are asking for to expedite their procedures for these intermediate healthcare service centers, which address the needs of folks who are who may have a substance use disorder. And what it does is it clarifies what they call an exemption process, but is truly an expedited process for achieving a certificate of need for these facilities. And the only thing that's different between the current CON process and the process they're recommending is that it does not include interested third parties or competitors. So they are simply looking at that facility individually in terms of the need. The other thing the bill does, which was one of the reasons why I said I would take the bill late, is because it gives the MHCC the ability to have input when a facility wants to expand. Right now, all the facility has to do is say, we're going to add 50 beds to our facility. That's all they have to do. With this bill, they will have to say, we would like to add 50 beds to our facility. Can we talk to you about this and how this would work and how we have the capacity to do this? So that is, that's what the bill does. And with that, Madam Chair, I would move the bill.
The bill has been moved and second. Any questions or concerns? Delegate Shalega.
Thank you.
You're welcome.
And I'm sorry I was at a doctor's appointment and missed the subcommittee work on this. So it sounded like you said no competition. What did you say?
Apparently in the CON process, when they bring people together, for a typical facility, they bring in entities that might be competitors for the person applying for the certificate of need. In this process, they would not do that for these facilities.
So is this going to make it easier?
Yes.
But it doesn't go as far as I would like it to go, which would be to get rid of the CON.
Correct, but it's in that direction, Delegate.
Do we need to put some time frames on it?
Yes,
so that
it's 45 days.
They have 45 days to comment,
days.
so they're not tied up as
right.
Delegate Riley and I, our hospital was tied up for 5 years trying to get through the CON process. So.
Right. No, that's why I call it expedited. Apparently the term of art is exemption, but it's really just an expedited process. It still maintains the standards that they use to evaluate the need, but it just expedites it by setting time frame, much shorter time frames and eliminating the competition from the process itself.
Thank you.
Thank you, Delegate.
Any other questions? Delegate Johnson.
Thank you. So the intermediate healthcare facilities, are they currently under certificate of need, or is this putting them back under certificate of need? Or?
They are currently under, in order to get to set up, they need to do a complete CON process as it is currently defined. Under this law, they will do the expedited process.
Okay, thank you.
Any other questions? All right, concerns? All those in favor say aye.
Aye.
Any opposition to the bill? Seeing none, the bill passes unanimous. Let's move on to Senate Bill 3, Senator Ellis, Work Group on the creation of data dashboard of public work contracts and apprentices establishment. It is favorable. It is Lindsay.
This is the cross-file of House Bill 850. You all already concurred on amendments adding 3 members. So with that concurrence, this is identical to House Bill 850.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes unanimous. Senate Bill 177, Procurement State Department of Education Local Food Purchasing Program. Senator Hester, it is favorable. It is Lindsay.
This is identical to House Bill 56.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes unanimous. Let's move on to Senate Bill 407, Senator Bidel, State Board of Nursing, Advanced Practice Nursing Licensure. Favorable, it is Lindsay.
This is identical to House Bill 602.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes unanimous. Senate Bill 653, Senator McCray, Procurement Employee Stock Ownership Plan Preference Pilot. Favorable with amendment. It is Lindsay.
So this is not identical to the cross-file HB 819. What the Senate did is, rather than allowing for a percentage preference for entities that utilize an employee stock ownership plan, they instead allow for the establishment of an evaluation factor for those ESOP entities. Because of that change, there still need to be amendments to this bill because the Senate failed to strike language relating to bidders. So an evaluation factor would only apply to someone who is an offerer, not a bidder on an RFP. So the amendments are just technical in nature, striking references to bidders throughout the bill. And that concurrence on HB 819 will come to you at the end of this voting session.
All right. Amendments have been moved in second. Any questions or concerns on the amendments? Delegate Hill.
Thank you. So they've amended it differently than Delegate Gazzoni's bill. I'd like to hear from Delegate Gazzoni, and because it sounds like we're accepting the Senate changes, they're not accepting ours.
Well, that's not exactly it, but I'm fine. There we go. I'm completely fine with how my bill just finished in the Senate earlier today. And so this is just going to get theirs to that product. Everybody's happy.
Okay. Any questions or concerns? Any other? All right. Seeing none on the amendments, all those in favor say aye. Aye. Any opposition on the amendments? Seeing none, the amendments pass on the bill as amended. Move the bill. The bill has been moved and second as amended. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes unanimous. Senate Bill 676, Senator Guile, Healthcare Facilities, favorable. It is Aaron.
It's identical, but it was not unanimous, the cross-file.
Okay, so Bagnell. Oh, I'm sorry. She's excused today. Bill has been moved. She's here, Spirit, because we love her. And if you're watching Bagnell, we love you. Feel better. So the bill has been moved. And second, any questions or concerns on the bill? All those in favor say aye. Aye. Any opposition on the bill? Delegate Shalega, Chisholm, Morgan, Riley, Hutchinson, and Kipke. You owe her whatever pie she likes. What pie do you like, Delegate Riley? What's your pie? Yeah, which one do you like? I'm going to choose for you key lime pie. Okay. So let's move on to Senate Bill 691, Senator Hester, Healthcare Ecosystem. We just did this yesterday, didn't we? Oh, no. All right, is it favorable, Lindsay?
This is identical to House Bill 338.
Bill has been moved in second. Any questions or concerns? All those in favor say aye. Any opposition? Seeing none, the bill passes unanimous. Senate Bill, bless you. Go ahead, one more? Okay. Senate Bill 921, Senator Guile, health insurance, step therapy, or fail first protocols. It is favorable. It is Lisa.
It's identical to its crosswalk.
Bill has been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes unanimous. Senate Bill 975, Senator Lamb, health insurance, coverage for specialty drugs. It is favorable. It is Lisa.
Also identical.
Bill has been moved and second. Any questions or concerns? All those in favor say aye. Aye. Any opposition? Seeing none, the bill passes unanimous. Do we have concurrences?
I do have one.
Okay.
We also were going to discuss
773.
773.
Okay, so let's discuss 773. Go ahead, Lisa. We have a discussion on House Bill 773. Lisa's going to tell us about it.
So since we considered this bill yesterday and we're conforming it to the House bill, we're still in large part conforming it to the House bill, but we are going to have some substitute amendments on the House floor. And what those do are remove the provision requiring the assistance to last for the plan year, and instead requiring the notice. There's a notice requirement in there that the whoever's providing the assistance must let the insured know the duration and the amount of the assistance. So we're including in that notice a provision that if the person providing the assistance does not comply with the maximum dollar amount and expiration date, that the insured should file a complaint with HGAU. And the notice would also include the HGAU's information. The amendments will require HGAU to report to finance and HGO on the number and type of complaints they receive. And it adds a sunset for 3 years and 6 months because that allows us to come back into session. The bill has a January 1st enactment date.
Okay, amendment has been moved and second. Any questions or concerns?
Not a question or concern, Madam Chair, but if I could just explain how we got to this point. We did a lot of research yesterday. We spoke with the advocates for the patient advocates for the bill. And what we learned is these assistance programs vary. They are like all over the map in terms of how they're implemented, where the funds go, who is getting the funds, where, it is different, for virtually every plan. So I was very interested in making sure that the patients have the benefit of the allowing the assistance to go towards their deductible, and in order to do that and get the support we needed to move it, we needed to remove the plan year from there. So, but we wanted to make sure that the program, as it proceeds in Maryland, is above board, is making sure that that it's being implemented to the benefit and advantage of the patient in all aspects. And we want to take a look at it in 3 years to say, is it working? Did it impact the prescription costs for our carriers? And how should we use it going forward? So, Madam Chair, I'm open to questions if there are any from the members of the committee.
Any questions to the Vice Chair? She really wants them. No, just kidding. Okay, since there are none and the bill has been moved, all those in favor say aye. Aye. Any opposition? All right, seeing none, it passes. Anything else? All right, we do have, oh, go ahead. Excuse me? Oh, yes, yes. So for the concurrence, we have House Bill 819. Lindsay, you want to go ahead and tell us what the change is?
This is the ESOP bill we just discussed, so the changes to the evaluation factor instead of a percentage preference.
Okay, so we're going to move to concur. Are there any questions or concerns about it? All right, and you're fine with it? Beautiful. All right, seeing no concerns or questions, all those in favor of concurring with the Senate amendment say aye. Aye. Any opposition? Seeing none, we do have more concurrences.
Sorry, I have
It's okay.
one note.
All right.
Here's what it does, there's what the bill does, and then.
So we have House Bill 1146, which is the Maryland Behavioral Health Crisis Response Systems, integration of 98A Suicide and Crisis Lifeline Network and Outcome Evaluation. The bill, House Bill 1146, alters the program and reporting requirement of the crisis response system. Each state 98A Suicide and Crisis Lifeline in the system must be coordinated with the national 98A Suicide and Crisis Lifeline to provide the Lifeline full range of services. This bill, what it does, this concurrence, is the amendment provides that the collection, analysis, and reporting of the data derived from the evaluation of outcomes required in the bill will begin in December 2026. So it's a change of date. Are there any questions or concerns? Seeing none, all those in favor of us concurring with the Senate say aye. Aye. Any opposition to the concurrence? None. The concurrence passes. Are there any more? I want more. No, okay, just kidding. All right, we are done. You guys get to, Delegate Hill.
We had House Bill 1515 at the beginning, but I'd like to amend on if there's opportunity on that House bill.
There's no amendment.
Oh, it's just favorable.
It was favorable. Not even with a good lawyer can you do that. All right, so you guys get to rest a little bit, bring us down. Thanks, everyone.